Hi, so we have just hit record on this interview. I'm very excited to be interviewing Silvana here today. I think that I will be able to learn a lot from this conversation, and anyone watching will be able to gain some insight about the work that Silvana does. I'd like to introduce myself really quick before we get started. My name is Olivia. My pronouns are she, they, and I am the communications director for Therapy Access Project. Therapy Access Project was founded to help match Black, Brown, Indigenous, and queer individuals with therapists that validate their identities and lived experiences. And then we also aim to share resources and information with disproportionately served populations. So that is a little bit about what we do. And then if Silvana, I'll pass it over to you so you can introduce yourself and a little bit about your practice.
Of course, yeah. My name is Silvana Espinoza Lau. She, her, ella pronouns. I am a therapist and also a coach in private practice in Kalapuya land in what we know as Oregon. So that's where I am at. And yeah, I mainly work with BIPOC individuals on racial trauma. I live in a very wide area of the country. So to me, it's very important to be able to support those communities and to also support other clinicians who would like to support minoritized communities as well.
Yeah, that's one thing I'm really excited to talk to you about is your work with other clinicians and their work in like decolonizing therapy in their practice. So I'm really excited to get into those
Cool.
questions.
Yeah.
So we'll get into the questions. So the first one is, what made you want to become a psychotherapist?
Yeah, I think I belong to that chunk of that percentage of psychotherapists who experience something themselves and they went to therapy and decided, I can do this too, or I would like to provide this type of healing as well. So, in a nutshell, that's the reason why I decided to become a psychotherapist. There was a very dear loved one of mine, like 20 years ago, who was really sick with cancer, and this person was 15 years old. So I decided to become their main caregiver, not knowing that caregiver stress was a thing. This person is doing fine, thankfully, and I'm so happy about that. But it was 2 or 3 years of taking care of this person of my own volition. I'm not taking care of myself. So, of course, I needed therapy, and I went to therapy for maybe 2 years at first time. It was very useful. It was not perfect. Looking back, there were things that I wish that person had done differently, but it was 80% of what I needed at the time. And I was maybe 22, so I was very young, and I needed that. I was going to college, I was working, so I wanted to do things and I wanted to function in the way that I wanted to function. So therapy allowed me to do that or to go back to doing that. um, and it was such a great experience, such a I think it was a transformative experience actually, that I decided I think I can do this too, or I think I want to try this and I want to go to college and I would like to help others find this type of healing that I have found, and that is not, just a one time and done, is something that you can go back to. So this feels so cyclical and so like something that I would like to do. So that's the reason why I became a psychotherapist.
That's awesome. And so your experience with that individual therapist, is that like some of what you maybe change about your practice, the things that weren't necessarily working for you? Yeah.
Exactly, exactly. Looking back, I remember that that person was holding some beliefs that I don't share. Um, some male centering beliefs, not necessarily a full blown misogyny, definitely not. But there were things that I would change, definitely. There are things that I changed in my therapy style. The practices that this person used, some of them were very useful. Um, I wish it had been more client centered, which is a thing that we say a lot in therapy, but true client centered and true trauma informed. I
Mhm.
think that that is very important for a therapist, and to provide true informed consent as well, right? Like really let the client know this is what's going to happen. These are the potential consequences.
Mhm.
And we will check in, regularly about this if this is still working for you. So that is something that was not offered to me and that I like to offer as well. The idea of identities was not offered to me. The fact that not only are you a person back then, you're not only are you a young individual going to college, but you're also brown and you're also queer and you're all, like
Mhm.
how do your identities play a role in how the world sees you and how you see the world. So those are things that were not there, and that I like to bring to therapy and when I'm supporting therapists as well.
I love that.
Thank you.
Yeah. So the next question, what do you find most rewarding about working with your current clients?
What I find the most rewarding is a sense of community. Um, Not because my clients or the therapy seekers that I work with immediately become part of my community, but because through them, I continue finding my own communities. And I know that they find their communities. So it's a double rewarding experience. It's because it reminds me the things that we're discussing in therapy are things that I should be applying to my life as well. And so there's a lot of, in general, there's so much isolation right now, and there's so much imposter syndrome, and there's so much this idea of there's something wrong with me. I am not productive enough. I am not doing enough of this. My grades or work or my social life is not what I would like it to be. There's so much of this idea of not enoughness that, and I think that we all experience that, plus everything that's happening in the world, that it's so amazing to help people realize that to say it in a very simple way, that there's nothing wrong with them,
Mhm.
that, the way that society is working is really messed up in some ways. So you are feeling all the pushback from society. And here are ways in which you can find community. And I remind myself as well, like, how am I finding my own community so that I can continue healing to help other people heal? So that is, I think, what's the most rewarding. This kind of like parallel process between me and my clients, um, that is happening, and that I think it really, it's like a butterfly effect, like a very positive effect, because they are doing better, I am doing better, therefore our communities are doing better,
Mhm.
and yeah, that's very rewarding for me.
Yeah, definitely. When I started working with my therapist, like once we got into like how the way that you're feeling is directly affected by what society has told you to like feel about
Completely,
yourself, like your body, your
completely.
productivity with the way that capitalism like centers your self-worth and your productivity. So all of
Yes.
that once we were able to get so and I'm very fortunate that one of my first therapists is very client-centered and willing
Mm.
to make therapy political and
Yeah.
all of that those things.
Amazing.
So, but yeah, I love to hear that you're doing that with your clients. And then, like you said, the way the butterfly effect, even if you're not directly working with everyone in your community, you're touching the lives of so many individuals in your community who are then going out
Exactly.
there and able to make other people understand the way that they're feeling is directly affected by what society
Yes,
taught us.
yes.
Yeah.
It honestly gives me goosebumps
Yeah.
because and it gives me so much hope because my client is doing better. Therefore, they are going to, pour that into their communities as well, whether that's at work with their families or any other circles. And that's just so beautiful.
Yeah, it really is.
Hmm. Yeah.
Okay, so next question. In your opinion, how can mental health practitioners better support marginalized communities, particularly those who face intersecting forms of oppression?
Um, I think, and this is something that I believe not too many therapists think about because I think that most of us in grad school learn to be this idea of selfless individuals. We don't have to center ourselves in the session. Obviously, we're not going to center ourselves, but this is about the therapy seeker, this is about the client. And I think that when we do that, sometimes we forget to remember. We forget what our identities are, and we forget how they are playing a role in the therapy session, right? One example, I can be an ally to certain communities. Maybe I am a trans ally, but I forget that I am cis and that I have so many biases or so many things that I have not worked with that maybe I am harming the person that I want to work with, the trans individual that I want to work with. Same thing that happened to me as a brown person, right? I have worked with several well-intentioned white clinicians, but if you don't have my lived experience, you can help me maybe to a 50%, but you cannot help me with the other 50%. Maybe I need someone with that lived experience. So I think that one of the ways in which practitioners can support their marginalized communities, whether they belong to that community or not, is by knowing themselves better and knowing what are the communities that I can really support and what are the communities that I am not ready to support in a one-on-one basis, right? Another example would be maybe I do want to support the disabled community, but I am not informed enough. So I am not going to offer services one on one to any person because I could harm them inadvertently. But
Mhm.
maybe I can support other causes with my time, volunteering, or financially if I have the means. So there are so many other ways in which I can support certain communities, whether I belong to them or not. So I think that it's very important for me to know what my limitations are. And to also know if there is any sort of shame, guilt, or any flavor of saviorism in me so that I can challenge that, right? Because I think that's the problem with being a well intentioned therapist or a well intentioned person. I really want to help that community that I don't belong to, but am I falling into saviorism by doing that? If I am going to harm that community, right? I don't have to, well, I can feel ashamed because I am not helping them, but that is my own problem to work through.
Mhm.
I don't have to bring that to that person from that community with the potential of harming them inadvertently. So, again, to me, the idea is getting to know myself, getting to know what my limitations are when working with certain identities. And there's no shame in having limitations, or if you're feeling shame, transform that into action, transform that into education so that you know better, so that you can support that community in the future.
I love that answer, yeah, especially, understanding where your limitations lie when working with certain identities and being able to help them, find other mental health resources if you find through your work with them that you might not be the best
Exactly.
match. So,
Exactly, exactly. Maybe that's the best way that I am helping someone by telling them, look at my website. I have an amazing list of providers who maybe match your identities better. You can go to one of them.
yeah.
Or maybe I can provide you basic therapy. Maybe I can give you some psychoeducation, but I know that I don't have your lived experience. Therefore, after these many sessions, I will refer you to someone who has that lived experience, right? So again, the informed consent, the transparency of what I can do, how I can support you, and how I cannot support you.
Yeah,
Yeah.
that's awesome.
Mhm.
Um, do you work towards decolonizing your practice? If so, what does this look like for you?
Yes, yes, yes. I work on decolonizing my practice day in and day out. And decolonizing my practice entails decolonizing myself as well. I am in private practice. I am my practice. So in order to decolonize my practice, I have to decolonize myself. I have to unlearn so many things. I have to question so many things. So what does it look like for me? It looks like so many things. It looks like it looks like resting. It looks like remembering that I need to set boundaries, that I work only from 9 to 5 or 8 to 4, whatever you want your schedule to be. uh, it looks like knowing when to refer people out because I don't want to burn out, because I want to be the best clinician possible for my clients, for the supervisees that I work with, for the clinicians that I work with. It looks like going to therapy, and going to therapy ideally with another politicized clinician, with someone who understands how our systems impact our lives. It looks like questioning the treatment that I provide to my clients. It looks like questioning what are the modalities that I am using, where they came from, where they appropriated from, ancestral practices and ways of healing. It looks like actually centering my clients in therapy and at all times asking them for their permission if I want to switch gears, if I want to provide something else. It looks like collaboration, like an actual conversation connection with that person that I am helping. It looks like acknowledging the hierarchy as well, right? I think that therapists, we are still seen as, I went to grad school. I have so many hours of practice before getting my license. Depending on the state, you have to get like 2,000 or 3,000. And sometimes you have to do a dissertation, sometimes you just have to pass an exam, but an exam that is like 200 questions and for 4 hours sitting for an exam. So there's so much hierarchy in knowledge, and there's so much hierarchy in having that piece of paper that says you have a master's degree and you're a licensed social worker or marriage and family therapist, whatever is your designation. That decolonizing my practice also looks like questioning where my degree came from and what's the institution that gave me that degree and how colonized that institution is and how colonized is the education that I receive, not
Mhm.
just from grad school, but from college and even from high school. It looks like questioning all of that. And it looks like questioning who are those authors that I admired, that I look up to, who are those therapy providers out there selling you the next modality that really helps people, deal with their trauma. It looks like questioning that as well. So maybe some of those things work, but maybe some of those things were again appropriated from other communities, from marginalized communities. So it looks like knowing where my healing modalities come from, and it looks like informing my clients about those healing modalities. Um, it also looks like politicizing my therapy practice and making it very clear to my clients that I have a politicized style. And so and my clients will know from the very beginning. So it looks like being very clear in my informed consent
Mhm.
that I will bring up politics, or maybe I will bring up religion, or maybe I will bring up sex or any other thing that is considered a taboo, but maybe is impacting my client.
Mhm.
And my clients, the therapy seekers know that from the very beginning, because even if they didn't have the time to read that informed consent, that intake paperwork that maybe is 10 or 20 pages long, I make a note to myself so that I can remind them that that is a paper that they sign. So, what do you think about the fact that we may talk about politics or how politics affects your life?
Mhm.
So, that is a conversation that I have in the very beginning. Um, and it looks like calling in my colleagues as well, even the well-intentioned ones, the ones with privileged identities. It looks like reminding them that maybe they are being racist or they are being homophobic, that they need to educate themselves. And it looks like me asking for accountability from other colleagues as well and call me out when I am being, those things that I don't want to be. So it looks like so many things. And it looks like patience and pacing as well, because decolonizing myself and my practice, I believe that is not something that I can do in a year or in a month or in 10 years with a, perfectly designed plan. It looks like, sometimes I struggle with doing that. Sometimes I don't want to do that.
Mhm.
Sometimes I have a lot of energy to do that. So it also looks like respecting my pace and my energy and the time that I have, um, respecting my finances. Maybe I don't have the money to pay for a really nice, training on, I don't know, liberation psychology. I don't know. So it looks like respecting so many things for myself as well. It looks like really be connected to myself and to the people around me, and to their needs and to my needs. Uh, yeah, so it looks like so many things, and I can just keep on going, but
Yeah.
I'll stop there.
Yeah, you said just so many important things that I'm just excited to see so many more practitioners embodying, like not only, working on yourself, but recognizing the hierarchy and where you may have been automatically privileged to be able to become a licensed therapist, but then further
Yes.
than that, really discussing how you being a therapist, you have to in some cases abide by the carceral system, and
Yes.
you're giving them as much informed consent as possible. So many
Exactly.
amazing things that you're doing.
Thank you.
Yes. So how do you envision the future of therapy practice, particularly in terms of decolonization and re-indigenization efforts?
Um, I would hope, and I really do envision this because there's this term called radical imagination, right? That says that we do live in someone's imagination. Somebody imagined this reality for us, right? And through laws and through expectation, cultural expectations, society exists the way it exists because somebody or some people imagined it. Usually, people with a lot of privilege. So why can't we imagine radically a different way of doing therapy or a different way of providing healing, right? So the way that I envision therapy is a therapy that is really person centered, in a way that is centering the client, the therapy seeker, but it's also centering in a healthy way the clinician, right? Center in the sense of I need to remind who I am and what my identities are, like I said before, so that I am really sure that I am providing the best service that I can provide. It looks like, to me personally, it looks like getting involved in politics. And it doesn't have to be the major politics, it can be your local politics if you have the time and the money and the energy to do that, right? Um, it looks like supporting different laws or supporting change at the systemic level. It looks like questioning the way that private insurance work, and it looks like questioning the way that even some group practices work. Especially the ones that tell you that you have this many hours of PTO, and if you don't have that PTO, well, you can take unpaid time off and work on your self care. So it looks like revision in so many things. Um, because if we really have the energy to help other people heal, then we will also have the energy to question the way in which the system works, and we will have the energy to decolonize our practices. I think that the other thing that I envision is for us clinicians and maybe for all service providers in general to continue questioning where our practices are coming from and to continue questioning how much hierarchy is there in our practices, how much of my treatment I am imposing on my client, um, and how much of a say they have on accepting a treatment or not. As for re-indigenizing treatment, I think that that is something very personal. The way that I would re-indigenize my own way of providing therapy is by reconnecting with my roots, and my roots are in South America. So even if I have indigenous heritage, my indigenous heritage is not connected to this part of the globe, to North America or to the US. So I want to be very respectful of that. How am I reconnecting to my indigenous roots? So it looks like respecting what it's not mine, uh, and connecting in a respectful way with the things that I lost via colonization, right? Because even as an indigenous person, I am a very privileged indigenous person because I was not born in those areas of my country where indigenous people really had a hard time with terrorism. I was able to learn Spanish, and that's not something that other indigenous individuals can do. And it's a privilege, but it's also a curse, not knowing their indigenous language. So I know that my lived experience is different. So as I reconnect with my indigenous roots, I want to do it in a very respectful way, acknowledging what's my privilege within that community. So I would hope that other clinicians, if they have indigenous roots, they would also reconnect to them in a very respectful way. And I would hope for clinicians who are childrens of settlers and childrens of colonizers, to also remember that they have roots elsewhere, and maybe those are the practices that they can bring to their therapy practices, right? We all came from somewhere, and there were healing practices in those communities. And to really think twice before incorporating practices that don't belong to them, um, because that can be so harmful
Mhm.
for indigenous communities. Um, and I would ask those clinicians to maybe highlight other practitioners who are indigenous and who are offering those practices. Maybe to refer to those clinicians, as opposed to me making money out of a practice that doesn't belong to me.
Mhm.
So those are some of the ways that I envision the future of therapy. I also envision using whatever modality I want to use, even if it's not an evidence-based practice, even if it's not peer-reviewed, because again, who are these people doing the evidence, deciding what's evidence-based, and who are these peers who are reviewing what
Mhm.
is acceptable within therapy, right? If those are individuals who have mostly privileged identities, then they don't understand how my community heals, and how can they approve what's good for my community or not
Right.
when my community has been doing things for centuries in the way that it works, right? So I would hope that we can continue questioning the way that we're doing therapy, and that we continue unlearning as a way to decolonize therapy and as a way to re-indigenize therapy. Last thing that I will say is, if I don't identify with the local indigenous community, if I don't belong to them, I can still support them. I can give 0.5% if that's all I can afford of my earnings in order to pay rent to the original owners of that land. So maybe I am helping them in different ways, right? I am helping in a different way. So again, there are so many ways in which we can decolonize and re-indigenize our practices.
Yeah. I
Yeah.
loved hearing about the different ways that you're reimagining therapy or mental health services. So yeah, 'cause, um, this one you kind of touched on, but how do you navigate power dynamics in the therapeutic relationships, especially concerning issues of privilege, oppression, and colonial legacy?
Yeah, yes. I kind of touched upon that already. I like to, not within the therapy session, but maybe I do this on a daily basis, but I like to have some time for myself to continue thinking and rethinking and unlearning what are the colonial legacies that I am bringing to not just my practice, but to my daily life, right? In what other colonized beliefs I have, in what other ways I am still colonizing my life. Even if that's with a belief, with something I say, with the way that I interact with people. Um, and when I am in the therapy room, I like to bring that up from the very beginning. Again, as part of my informed consent, as part of that first session when we're getting to know each other, and I tell you how I work as a therapist. So I like to bring up the fact that there's a hierarchy, the fact that usually, we think that therapists know more because we know we have all this book knowledge. So what I like to tell a client is, maybe I do have some book knowledge, but I don't have the wisdom that you have about yourself. And I do highlight that a lot. You do have inner wisdom, and maybe through colonization, you forgot that you had it because you were colonized into thinking that you need to go to a professional, you need to go to this specialist, and they know better than you. Well, I don't believe that. I can know what the books taught me, but I don't know anything about your life and what's best for you. And we're going to figure that out together. But in the end, you are the one who make these choices. So I try to give that power back to my client, acknowledging that, yes, at the end, you know, I am the one coordinating care with your doctor, if that's the case. And maybe your doctor will believe me more than they believe you. Let's just be very honest about that, right? That's unfortunate. And maybe that's a reality. So I will do my best to advocate for you and to collaborate with you in your treatment. So that's one way in which I navigate those dynamics. Consultation is an amazing way to navigate through oppression because maybe I do have foggy spots, things that I am not aware of. So I need other peers to help me see those things that I am not seeing yet. Um, and the same thing with privilege. I remind myself every time, what are my clients' identities and what are my identities? So, where am I actually understanding them and where am I not understanding these clients and how that can be harmful in the therapy session? So, those are some ways in which I navigate, all those dynamics.
That's awesome. Um, we're kind of running out of time, so I think I'm
Mm,
just gonna go ahead and skip to the last one because we did kind of
sure.
cover this second to last one in
Yeah.
our conversation. So, do you have any tips for those going to therapy about how they can get more out of their session?
Completely, completely. I would say that it is okay for you to disagree with your therapist. It is okay for you to question your therapist. Um, it is okay for you to trust your intuition um, when therapy is not going well. It is okay for you to have that conversation with your therapist about how productive or how healing the therapy session feels or not. If you are just starting therapy, it's also okay to ask any and all questions to your therapist about how they provide treatment, how they um, how they navigate power dynamics,
Mhm.
whether they have a politicized style, if that's what you want. So be very clear about what are the things that you want out of a therapist, what are the healing modalities that you want, what are the things that you don't want, and what are the things that trigger you so that you can bring that to your therapist, right? Maybe some of the things that trigger your trauma, so maybe it's okay for you to get mildly triggered so that your therapist can help you with that. But
Mhm.
maybe some things are triggers because of systemic oppression. So it would be okay for you to call out your therapist and tell them, you just said something racist, so I'm not coming back here. Or how are you going to repair this?
Mhm.
So it is okay for you to have a voice and to remember that your therapist may have this knowledge from books, from grad school, but you do have an inner knowledge and you do have that inner wisdom to have a conversation, horizontal conversation with your provider about how your treatment is going and about what else you would like to see happen in your treatment.
Yeah,
Yeah.
definitely. Yeah, we've in the past done posts helping individuals to recognize that a sign of a therapist that you're actually going to be able to embark on a healing journey with is one that's, willing to be transparent about
Yes.
a good majority of their practice, and then also okay with you saying, I don't know if this is gonna work, or like I'll need
Hmm.
clarification on this about your practice in order to work with you. And a therapist who
Yes.
doesn't get offended by those questions is usually
Completely.
at least you're gonna be able to work with them to a certain extent, and they'll probably help. If
Completely.
it's not the best match, they'll probably help you find someone else.
Mm-hmm, 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 mm-hmm. Yes, work with a therapist that allows all your feelings.
Hmm.
Um, and don't work with a therapist that take things personally.
Hmm.
There's nothing wrong with that. I would assume that that person just needs to do their own therapy and more work to understand that you're holding space for someone else, right? Your therapist is holding space for you. So, yeah, you should be able to ask all the questions and to expect transparency from your therapist, of course.
Yeah.
Yeah,
Well, thank you so much for joining me for this interview.
of course.
I learned a lot, and I'm sure that anyone who watches this interview or sections of it will learn a lot too. I have your socials here, so I'll go ahead and plug them, and then they'll also be linked in any posts that we do or our newsletter and everything like that.
Cool.
So your Instagram is Decolonize Your Practice,
Mm-hmm.
and LinkedIn is Silvana Espinoza.
Mm-hmm. Espinoza Lau. I think
That
my, yeah,
Okay. And then your website is Seventh Self Count Consulting. Seventh
mm-hmm.
Self. Okay.
Yeah, that's
All
correct.
right. All right. Well, thank you so much for meeting with us.
Yeah.